Okay, anyway, so I'm going to start. Those are so short and sweet. You're going to see. The idea is that, well, so I'm a rheumatologist. I love rheumatology and I love educating, and I love educating in rheumatology. And so I have this YouTube channel called Rheumatology 101. And what I was realizing is that I actually never really edit my videos. And I thought, okay, well, first of all, it seems like those Rheumatology 101 are really appreciated by the community. So that's the first thing. And the second thing is that how could I improve this so that more people can have access to this, and that I could actually offer even more with those. And I thought about this and I was like, well, hold on, if there could be some question and answers at the end. And so that's the reason I'm doing this. Hopefully right now I see that there is no one live, but I'm really not worried about this because I think you can actually always look at it later. So there's replays and all this. But really, like, I'm going to commit to you all that I'm going to do a live about rheumatology once a week at 11. So it's 11 a.m. Mountain Standard Time or 1 p.m. for Eastern Time. And I think that that's just 10 minutes of talking about rheumatology topics that can potentially really help you. And if you have questions, don't hesitate. It's great if those questions are related to the topic. So today we're going to talk about rheumatoid arthritis because it's a really common autoimmune disorder. And then, if you have any questions of things that you would like us to discuss, you don't hesitate. Please let me know because that's the goal. It's really for the community. I know all of those things. I mean, I keep improving, but the improvement that I have as a rheumatologist are much more fine-tuned, related to medications or new advances in pathophysiology. It's a little bit more complex, and that I don't think that you need all of that. Of course, as we grow all together, maybe you do, and then I will bring you more of those things. So rheumatoid arthritis in a nutshell, and really the idea here is to give you an idea. Imagine that you have someone that has rheumatoid arthritis. I'm going to say RA. It's a little bit easier to say. So someone has rheumatoid arthritis, RA, in someone around you, or you have just been diagnosed with rheumatoid arthritis, or you're wondering if what you have rheumatoid arthritis. So come and listen, and you should be able to respond to those questions of what this is and what it means for you or for your loved one. So rheumatoid arthritis is an autoimmune condition. And it affects mostly the joint, and it causes pain, inflammation, swelling, as well as destruction of the joint if you don't take care of it. But it also doesn't just affect the joints. It can affect your whole body. It can affect your skin with inflammation of the vessel leading to vasculitis, and that can cause some nodules. It can cause some ulcers on your skin. It can cause what I was saying, nodules on the skin. It can affect your eyes with inflammation of the eyes. It can be a really problematic condition if it affects the eye. It can affect your lungs with rheumatoid arthritis, interstitial lung disease, but it can really do a lot of different things in the lungs. It can affect your heart. We actually know that it's linked to a certain type of heart failure. It can affect your vessel. We know that patients who have rheumatoid arthritis, and especially rheumatoid arthritis that's not treated, can affect their vessel. It can have more myocardial infarction, so MIs, and so on. It can affect your nerve. So that's a little bit less common, and it's usually when you have inflammation of the vessel. It can affect your nerve. And the overall, it can cause fatigue, fever, and so on. So, I mean, of course, the vast majority of patients are going to have just joint involvement, but very often they also complain of fatigue. And this fatigue is most of the time related to the fact that there is inflammation, and also because this inflammation can cause also anemia. So you can actually become anemic, so less red blood cell, and that can cause fatigue. Okay, so it's really, when we are looking at rheumatoid arthritis, we are really looking at a condition that is not just joint, but really affects all of the system. The reason why you may have rheumatoid arthritis are twofold, and usually we use this two heat idea, like this concept of two heats. You may be at risk to develop rheumatoid arthritis because in your family there is rheumatoid arthritis or other sort of autoimmune disorder. Maybe you have more autoimmune disorders such as Hashimoto thyroiditis, so it's hypothyroidism due to autoimmune disorder. That's not something you can really help with that. But then the second hit would be that you smoke. And we know that smoking can cause rheumatoid arthritis, that you eat a lot of processed food. We know that processed food can basically is associated with more risk of developing rheumatoid arthritis. Or you have had an infection. There is an infection that we call parvovirus B19. It's usually in kids, and it causes what we call the slap cheeks disease. They have like red cheeks. And that can cause an inflammatory arthritis that can go away, but it can also lead to rheumatoid arthritis. And then we also know that COVID-19 can lead to rheumatoid arthritis. And it's not just just COVID-19 rheumatoid arthritis. It's really just you have a background that puts you at risk for rheumatoid arthritis, and then you get COVID, and that's the second hit. And same thing with smoking, same thing with all of those things. So it's really just, don't see it as like, oh, I'm doomed. My parents had rheumatoid arthritis, but more like, okay, well, what can I do to help this and to prevent this? Okay, so that's something. So if you smoke, we tried quitting smoking, where you can quit smoking, and that's doable. I'm a former smoker, so if I can do it, you can do it. And it's totally doable, especially when you know why you're doing it, right? But those are like some of the risk factors to develop rheumatoid arthritis. The other, and I don't know that we can call it risk factor, for rheumatoid arthritis is very often with changes of the hormones. So I see in my practice a lot of women who have just had a baby or stopped, they had a baby and they breastfed, and then they stopped breastfeeding, and then they develop rheumatoid arthritis. That's actually pretty common. And then around the menopause area, we also see that. And so that also adds to the fact that it's being an autoimmune disorder, just women have more risk of developing rheumatoid arthritis. So that's, the other piece of information that you would want to know. The symptoms of rheumatoid arthritis. So I told you it can affect all of the kind of your whole, body system. But most of the time, the vast majority, like really the main symptom will be joint pain. And it's not just any joint pain. It's what we call an inflammatory arthritis. And the way it works when we say that there is an inflammatory arthritis is it's different than what we call mechanical joint pain, mechanical arthritis. So, and that's really important because inflammatory arthritis are usually related to an inflammatory process that can cause destruction, and either destruction of the joint, like in rheumatoid arthritis, but also destruction because it's causing issues on more than just the joint, versus mechanical arthritis, where it will be just on the joint. And the way that we define, like we decide if this is inflammatory or mechanical, are three questions. One, is the pain worse in the morning? If it is worse in the morning, most likely this is more inflammatory. Two, do you have morning stiffness? You feel like you have to open all of your joints, and as if you had to put some oil in your joints to make them more fluid. And that, if that morning stiffness is more than 30 minutes. And then the third thing is if the joint pain improved with activities. Most of the time, when, let's say you have hurt yourself while doing a 14er, you're in Colorado, you did a 14er, you hurt your ankle, for example. And I'm laughing because that was my issue recently. So I hurt my ankle. Well, the pain is not worse in the morning. The pain is worse at the end of the day. The pain is worse when I'm doing something. If I don't do anything, I'm totally fine. I don't have pain. Okay, and that's really what this does, is that really it helps us decide, is this inflammatory arthritis or is this mechanical pain? And if there is one thing that I want to leave you with, it's really this: like, know when you have to see a rheumatologist. And if you have any of those three components of this joint pain, please go and see a rheumatologist. It's worse in the morning, it's improved with exercise, and you have morning stiffness. You're stiff in the morning for more than 30 minutes. Okay, any of those three, please come and see us. All right, now we will do another episode on treatments and what we can do. I want to let you just with this, okay? Number one, rheumatoid arthritis is a systemic condition. It affects not just the joint. So that's number one. Number two is that it's an inflammatory arthritis. And so that is different than what we call mechanical arthritis. And because it is an inflammatory arthritis, you know that the risk can be destruction of the joints, which is a problem, right? Or affection or like involvement of other system than just the joint. And then the last thing, and that's kind of like telling you, hey, come next week, is that we have incredible treatment options, incredible management for rheumatoid arthritis that involves not only medication, but also lifestyle changes. And so I want you to be hopeful. If you know someone that has been diagnosed with rheumatoid arthritis, or if you have been diagnosed with rheumatoid arthritis, I can really tell you that this is probably the one condition that you should be the most hopeful about, because we have incredible treatments. Okay, I didn't go into how we diagnose it. I will let you know. I started talking about this, but we will do that like next week. We will do how we diagnose it, and then the week after we'll do how we manage it, and so on. And so come next week. I'm really excited to be here. Talk to each other. If you think that this is useful, let me know. I mean, I'm doing this really in short bits. I don't think we should do too much. I want to leave time for questions. And so, and then, let's grow this. It's such a pleasure to be here. If you are looking for a rheumatologist, I'm still currently taking new patients in my practice on Average MD. It's a concierge rheumatology practice. I absolutely love what I do. I really put patients in remission much faster than I've ever done in the past. And I think that's it. So contact us at info@onaveragemd, or you can let us send us a message or anything. I look forward to seeing you, but most importantly, I really look forward to seeing you next week. Take care. Bye-bye.